Good morning. Thank you all for attending. My name is Harrison Pierce. I'm the Chair of Health and Human Services. Well, it's a new year. We've recovered, ready to get going. Barb, thank you so much. I know it's early out there, 6:45.
It's okay. Happy to be here. Happy New Year, everybody.
Okay, so let's see. First item on the agenda, approval of the December 1st minutes. Any corrections?
I'd like to add, and in the chaos of the last few minutes after our heated discussions on outside services, I made a motion, which is not included in the minutes, which I've given to Alyssa, to add the following approved at the end of the minutes as published. After in the next to the last paragraph, after the words must consider that regardless, following 23-24, the Kids in Crisis grant will double, which I thought was worthwhile anyway. But to insert the following approved action, because we had a motion that I made and was seconded and approved unanimously to accept the 11 outside agencies. So it would read, the new insertion would read, concluding discussion of outside agency services and budgets. Commissioner Lister moved that the commission approved the list of 11 outside agencies and recommended town grant amounts for each totaling $194,000 as recommended by the Human Services Department Director.
Thank you. So, in the minutes,
Yeah, a very important thing because we spent a lot of time.
Yeah, that's okay. Thanks for cracking it.
Any questions, comments, otherwise? May I have a motion to approve?
Lacy Meyer.
Here. Second, all in favor? Aye. Thank you, Listen. Reports, Health Department, Jen Austin.
Can we do your election of officers? I can only stay up tonight.
Okay, right, so we're going to bypass the two categories here. And move to the commission members' terms.
Okay, I should. Technically, at the call of the first selectman, all boards and commissions have to elect their officers, so I'm calling the selection. And I'm also an ex officio member of every board and commission by statute, so I plan to stay at 9:30. Participate in one topic in particular if we get to it. But anyway, I would call for the nomination of chairman of the commission for the ensuing year. Do I have a nomination?
I would offer Harrison to continue on as chairman.
Do I have a second? Okay. Any further?
I'll drive you.
Any further nominations for chair? Hearing none, all in favor of Dr. Pierce?
Can we just hear like a second on Harrison's vision and for the year, just a couple comments on that? I mean, I think everybody feels very good that Buckfoot is here.
No, I understood your question. All the ramifications, we will continue pretty much as we are. We are looking to define the role of the commission. That's one of the outstanding things. I know there's some varying sentiments. I think some people maybe feel a little frustrated that we're not doing more than we're doing. Reality is that when I first came on board, I thought that I would be doing more than I'm doing. But as I think as we go through this discussion, we will see the role of the commission is much oversight and advice. And we're somewhat limited as to what we can do moving forward. But I think by the time you want to vote now, and I'll be happy to leave the room, I think we'll have a clearer view of where we're going or not. So, good brief.
But I think there's good momentum now and just continuation of that, having a voice and really monitoring what's going on, helping the other agencies and kind of understand the issues. And, I think that sounds great, but for me, I'm really excited about what we've been doing the last couple of months and excited to continue.
Sounds good.
One thing that I would just add to that, Harrison, I think the last couple of months, I think have been really exciting for the commission. I think as long as we're still focusing on setting priorities and having more of a leadership role as compared to sitting here and listening through presentations and not having an active discussion that we've had in the last couple of months, I think have been worthwhile. It's hard when we're limited to only the last 10 minutes to kind of have an open discussion on some of the setting priorities and sending recommendations to town council, sending recommendations to the board of selectmen. I think as long as we're moving in that direction, you know, I think I'm just speaking for myself. I think that would be very, very positive changes that we can make in enhancing our mission, if you will. Our charter is set out, but I can't remember the last time that we've had a formal presentation to the Board of Selectmen in terms of us all voting together. These are our recommendations needs to go to them. I know we did that for the grant writer, and I think Kevin and the Board of Selectmen for approving that, but rubber stamping kind of the same donations every single year without setting priorities, I think is something that I'd like to see change going forward as your leadership role. But you know, I'm torn because we're all volunteers here, right? We're all putting in an extraordinary amount of time and reading and effort preparing for our meetings. So as long as we're building in that direction, I'm very supportive of you.
Upstairs, is there anything you want to tell me?
I just want to know if the goat, what she's coming at us with.
Silent so far.
I'm listening to a meeting.
Is there someone other participant in that?
Yeah.
Yeah. Kim, could you mute your? Where's Kim? I think she just called in.
Yeah, participants. More, there you go. Oh, she good. Okay.
I'd like to make a comment. First of all, I'd like to thank Dr. Pierce for his service. He was the right guy at the right time for COVID, being a retired pediatrician, and I value his advice, as I think all you do. I think you know, the role that you guys have done on the committee for a long, long time, and you know what this committee has done over time with respect to senior housing studies and other studies. You know, one thing I often say that, you know, a town like ours, which is very lucky, has relatively few problems. But we do have some problems that we need to address, and I'm thrilled with what we're doing with Silver Hill Hospital on this program. That's part of what I want to talk about this morning. But your role is to advise the selectmen. You know, most of our boards and commissions are advisory. Some have management responsibility. Like the police department is managed by the police commission. The fire department has more authority over their fire company than the selectmen do in many respects. But as far as being advisory, we value your advice, and I think, you know, you've done great things in the past with respect to particular projects. And I would encourage you to think about projects that contribute to the community. You know, your bench project was great. The study you did on senior housing was great. I think so. I find your way. But you have some great precedent in terms of what this commission can accomplish. So anyway, now unless there's another, we did have another nomination, so I would ask for a vote on Dr. Pierce to continue as chairman for.
Be happy to.
Get down here.
Be true to yourself.
But I did it in the absence.
We have to hope this doesn't go to 7 votes.
Yeah.
But honestly, in the absence of another nomination, you have the opportunity to nominate someone else. You can't. So anyway, if you don't have a majority vote for Harrison, we can talk about it. But anyway, I would call a vote on the Harrison. All in favor? Aye. All right, is that unanimous?
Yeah.
Ready to say?
Absolutely.
I would leave for the rest of you any further discussion about your role, and Harrison, you can get back in.
Poor man.
Told this will be short. Harrison.
He like ran away.
No.
That was short.
Work the exit.
It wasn't happening.
I'm not calling nomination. Thank you, as we tell our children and now grandchildren, just do your best. With, like, built-in shortcuts.
I would now call for nomination for the role of secretary.
I nominate Elizabeth Matthews to be involved.
Any further nominations? All in favor, Alicia, continue. With
Aye.
With unanimous,
With my sympathies.
I'm gonna say it 9:30, but I think.
Thank you. Let's see, okay, back to the agenda, health department, Jen Allison.
Okay, so, we're still holding a COVID clinic and flu clinic. The FDA and CDC did approve a new bivalent booster for ages 6 months to age 5. That's our last age group. We've only had 2 calls for that. We don't expect a lot of demand for that. The one thing that did change with that though is Pfizer is not a 3-dose vaccine anymore for that age group. Now it's 2 doses, and then the bivalent will be the 3rd. So it won't be 3 + 1 for 4. So that was a huge change. Testing, actually December was nice and quiet for us, which is bizarre. We are not used to that. Last year it was, running around like crazy with all the cars. We had less than 100 PCR tests and antigen tests. We had 28 with 10 positive. Obviously, they're more symptomatic. Case-wise, we're around 25 this week, which again, putting it in perspective, is still low. Now, obviously, there's home tests and all that going on that we don't know. But even the schools aren't seeing a lot with the kids. I still am in touch with Janet Reed regularly. But obviously flu and RSV and the cold and everything else is around. I myself have been a victim of the flu this week, so I know how bad it can be. Here's why I'm wearing the mask, but I'm not infected anymore. Relicensing, all the restaurant relicensing has been completed. Deb and Gino did a great job chasing around the last few, because we have to get the tax sign off by statute, so a couple of them we had to wait for that issue. Building permits remain steady. Septic was down a little, complaints were up a little. The lead cases continue to come in because of this new elevated blood level of lowering it to 3.5. And the time that these cases take is a lot. And me and Gino are the only ones certified. They haven't offered another class. I'll get Shannon when it does. This was, again, another unfunded mandate when they lowered the levels. They promised us last year, we'll give you money to get staff, and that never has happened yet. So we don't know what's going to happen with that or when that will happen. I do want to mention with the COVID hospitalizations, if you look at the charts I gave you, it's the highest it's been since last February. So that is important. And if you look at the variant chart from last month to this month, it's drastically different. The BA4 and BA5, which is what the bivalent vaccine targets, is no longer the predominant variant. So that's concerning. And the XBB is beginning to rapidly spread. So, and how that's affected with the bivalent, we don't know. CDC hasn't been giving much data on that yet. Obviously, everything's happening in real time. And if you're looking at what's going on in China, it's a concern, obviously. Looking at the suicide ideation chart, remember back in the beginning when I first started giving it to you, the group 18 to 25 was the highest. Now you're seeing the 10 to 17-year-olds are the highest. So that is a concern and something that everyone should keep an eye on.
Is that because of college apps?
Who knows? I mean, these numbers are just from the emergency room. So the numbers are probably a lot higher, obviously. These are just ones that are that bad that they end up in the emergency room. So that's a concern when you're seeing that young of an age group, you know, continually having issues. With flu, you're also seeing a dramatic difference from month over month. You know, last month there was only around 3,000 cases, now there's over 29,000 cases. There was only one death of last month, and now there's 33 for the season already. So you're seeing, you know, the increases beginning to happen, and this was without even Christmas and New Year's. So January might be a little bumpy ride. So we'll see what happens. We still are offering flu doses. We're still getting calls for flu doses. Again, we get them for free from the state. We're re-enrolled in the CDP program, so that's great. Another thing, the state is giving us only 20 radon-free test kits. We used to get 100, but that's for testing in the homes between January and April. And that's to see what the levels of radon are in the homes, because radon does cause lung cancer. So, and in parts of our town, we know geographically have higher bedrock where radon comes from the bedrock. So we will be offering those to the 20 that we have to the residents, obviously for free. And Gino will even go out and set them up if people don't know how to do it, to make sure it's done correctly. So you want to make sure it's done correctly. And then a final thing, NACCHO announced that Congress passed the Public Health Workforce Loan Repayment Program as part of the Consolidated Appropriations Act of 2023. What this does is it helps with our workforce development problem of offering up to $150,000 in loan repayment to public health professionals who agree to serve 3 years in local, state, or tribal health departments. And the degree must be in public health, epidemiology, or statistics. Because, and this all came about because the health departments before the pandemic have lost 21% of our workforce nationwide. In Connecticut, we have a massive problem with trying to find sanitarians and everything. This is in addition to that federal grant money coming from the CDC. And in that 12 million that the state is going to be giving to local health, which we still don't know how that's going to work. So we're hoping the Directors of Health Association can be working with the colleges and letting the kids know, you know, about this, because this will be huge for workforce development. Because the pandemic put a lot of stress, and a lot of the kids out of college we had quit and left because, you know, it's not been a fun 3 years, that's for sure. So we'll see, and I'll keep you updated on that, but I thought that was great news. And it goes back to 10 years. So you graduated within the last 10 years, so we might be able to pull people back into the field that were in the field. So that's a huge step.
But there's $105 million that's being executed as we speak from the legislature. There's ARPA money, actually. I don't know whether we're going to keep getting ARPA money,
No,
but right now it's gone. But the point of this is to recruit nurses, healthcare workers, and mental health workers particularly. We're focused on scholarships and whatnot to get people and unkinking the capacity in the universities. The problem is it's 3 years, and if you look at the numbers that are in the bill, the payoff is not for 3 years, basically. So, you know, the state recognizes the problem, but it's going to take a while to make it happen. And we're several thousand years a year short list in Connecticut.
There's two other things, and I won't spend much time on them, but I think it's worthy of us looking at. For 2022, only 66% of the students are in school, and these are students that took the test for the first time and retook the test. Only 66% passed. So they are looking at changing the test in order to increase the approval rate, which I'm against. Especially if I'm the patient. I want the person that got 100% of the test, not the person that got 66 and gets scaled up. So that is actually occurring. The second is, if you do the research that's coming out right now, COVID has pivoted right? When we talk about XBB as a prevalence right out in the Northeast, we're talking about immune imprinting that's occurring. So New England Journal of Medicine came out, Cell Digest came out with those areas that receive the highest rate of bivalent are actually seeing the highest rate of XBB right now. So this is something new. I think it's, as a commission, I think we should do a little bit of research on it and have a position on it. Because I can see this starting to hit the papers and starting to get traction that the areas had the highest inoculation rates are actually showing the highest rates of XBB in terms of COVID. So I think that sends the wrong message if it's not controlled, the messaging is not controlled.
What's the right message?
I think the right message is that we continue, especially for our seniors, the high vaccination rates, because we are seeing with XBB that their symptoms are extraordinarily mild. But because we were testing all of our people and screening them, we're seeing a higher incident rate right now. So testing is extraordinarily important, but there's symptoms that for those that have been fully inoculated with bivalent have only lasted 2 or 3 days and been extraordinarily mild. But hospitalizations have been up dramatically.
Yes.
So the hospitalization.
You know, deaths actually creeped up. Deaths are up.
But the hospitalizations, well, they can't be mild symptoms. Of people in the hospital.
I'm saying on average,
It depends, Tom, because the hospital data is still cloudy. Because if someone goes in for a car accident or something else, and they're tested for COVID, that counts as a COVID hospitalization. They don't delineate it. And we've been fighting for years for them to delineate it, and they don't. But obviously, when you have this higher numbers, there is higher numbers. But
and people who only have mild symptoms for 2 days may not be testing themselves,
Right.
right? They may think it's just a common cold.
Yeah.
You know, I'm not getting that 5-day, I'm not getting that COVID fog, so to speak. So anyway, it's something, if you haven't read about it, it is the research is being done right now. And you know, I think there's a great opportunity here for us to send a message to our community, get ahead of it, if you will.
The CDC last month did share that long COVID is an autoimmune disease, and so with each reinfection, you're lowering the threshold to be able to fight illness. And when you are infected and you do have a lower immune system, you shed more virus, so you're more likely to make other people sick. So it's kind of a snowballing issue that, as you said, is not discussed in the media at all due to fears of making people vaccine hesitant.
Right. So I mean, if you go to the state's website and click on COVID, it takes you back to April. It hasn't been updated since April in terms of their information. So you still see B1, B1A, right? And so I just think it's an opportunity for us to, with the health department, Department of Health, to get ahead of the messaging as the research starts coming out.
But when I leave this room, I cannot say anymore that if you get the full deck of shots, regardless of how they're keeping track of it, that death is, you can delay or avoid death by being fully vaccinated.
There's no way to avoid death.
So I have to make the motion.
Do this and die.
You reduce your odds of worse disease, being hospitalized and dying, but there is on average 2,000 to 4,000 people dying a week in the US from COVID. But the other thing that's difficult is that every state, every town has different vaccination rates, has different populations, so it's hard to.
But it's the same thing with the flu. The flu vaccine is generally around 40% effective each year. But it still will help lower your symptoms and lower,
But keep in mind,
Keep yourself
before COVID, right, there were
Yes.
annually, if you look at the statistics, CDC statistics, 17, 18, 52,000 deaths from the flu.
Correct.
Right, 18, 19, 28,000 deaths from the flu. We had an 8-year-old boy 5 years ago who died of the flu in Canada. Right, so the flu can kill. And I
So
thought,
can strep A, so can RSV. We have a lot going on right now.
yeah,
That's-
I like Jen and Bethany, we should return to address what we're doing with flu shots, because that's something that Darien has gotten out of the business of giving flu shots, but I think we ought to be in the business. And
well, we are in this.
And I think when we're citing stats are important. When you say, it prevents infection 30%, 40%, it's actually preventing hospitalizations. So they're looking at that rate of hospitalization being reduced by 30%, not the fact that you'll not catch the flu. So when so many people are skeptical right now in terms of getting shots and continue to getting it, I just think, as a commission here, very excluding myself, very educated people to do some of the research on it and come up with a policy on it.
And I think the other thing that people need to understand is that a lot of the antibodies, Evusheld is no longer that protective, if at all protective. Paxlovid was removed from the FDA approval. So the people who we think, like people like me, who we think that, okay, there's medicines, if I do get sick, those medications are increasingly less effective. And so that could also be why we're seeing an increase in deaths.
So Russ's point is well taken. The community should not discontinue no matter what we do. It's always better to be vaccinated, somewhat helpful. These variants present themselves and maybe less effective. But our numbers are still very good.
Mhm.
90% plus.
But I still see a need for some sharp communication to Russ's point. Because it's an unusual situation that people start to figure out the opportunity for misinformation, like you were probing.
Well,
I
again,
think Jen had a
the
real.
people who want the information are on my COVID list. We got, a lot of flack, keep sending it through Everbridge. So you have to be careful. Not everybody wants to hear about this stuff time and time and time again. So I have my list of about 200 COVID people that every single Thursday get the updates on what, going on. I don't want to shove it down everyone's throat of 20,000 people on Everbridge. Because then I'm the one dealing with hundreds of people screaming and yelling, knock it off, I don't care, blah, blah, blah. So, people can get the information. It's all on the COVID website, updated weekly, all our charts, everything's on there. So,
But if in our judgment, this is an unusual moment, like, I know, like Jason Portland in the hospital has had COVID 3 times in the last 12 weeks. That's weird. And I think this is an unusual kind of moment with this particular variant that I think
but we're
this
not,
is where we can make some kind of statement.
There's something.
I disagree.
That's the view of the.
I disagree, because our caseload is not that to create havoc and panic, when even in the school system, we're not seeing that. So, that particular individual might have some kind of immune system issue, because, I've never even gotten COVID. So getting it 3 times in a couple of weeks, something's off there.
That's
What we heard from our hospitals, do you have any recent
updated,
reports
no,
from
it's
hospitals?
low. it's.
And to Jen's point, the people that are there that are incidentally coming positive on COVID, that are there for definitely another reason. Is that it?
Stanford Hospital stopped routinely testing because of that. When someone comes in that actually is sick, then they'll test it. But if you're just going for a routine, I need to get a procedure done, they stopped doing that because, it was playing with the data and skewing the numbers. New York stopped that a long time ago. And it's been an ongoing issue. Right now, RSV and flu are the bigger problems going on, especially with children. And now strep A, children are dying from, which never used to happen.
They've tried to tease out the differential between really close hospitalization. It wasn't just coincidental. The trifecta viral surge that we've all heard about the last few months. It reminded me what was happening up at Yale Children's was like what was happening in Norwalk, Stanford, et cetera, where they were going around creating new ICUs. They were overloaded with the numbers, just going with the RSV, flu, and COVID. There's a region 1, which is the Northeast. there were no pediatric ICU beds available in that sector during these last 3 months. So we're just creeping into January, but the numbers from October through are very, yeah, it's an amazing, they've never experienced that. Like, so all these children's hospitals, et cetera. So.
Actually, can we just clarify, if we're talking about communicating something as a commission, are we talking about just communicating numbers and risk, or were we talking about just communicating what the actual situation is to try and head off information that comes out that doesn't describe what the actual situation is?
Well,
So for instance,
there is
vaccination.
fatigue phenomenon, and there's the fact that, this new may be difficult to interpret. But I think, Jen, should that come from health department?
No, I just said, I'm not sending the 20,000 people, and I take all the flack, because I've gone through this for 3 years. The people who want the information get the information every week or go on the website. I am not sending this to Everbridge. Everbridge is for emergencies only.
But I feel like what you're saying is people have been very clear, they don't want to receive a weekly email with like 10 cases up, 10 cases down, and all this
Right.
data that they don't really know.
But I don't have anything right now to report that's of
But
significance.
are we talking about possibly a communication from a trusted source for people, not through emergency communications, but just to say the New Canaan Health Commission has looked at this issue and here's what's happening. Here's what we know about this, here's what we don't know about this. Just in a separate way, not in an emergency communication capacity, but just in a, do we become like, this is a group of people that's reading about it. This is a group of people that's looked at all this different information. You know, you can say that you don't believe us or don't agree with us, but some people might say, that's great. that-
Well, what are you trying to say? Because the cases are not what they were last
I
year.
would suggest one of the priorities that we're talking about is public health preparedness. And I think what we're signaling here is to be agile and pay very close attention. I take Jen's point, this is not the moment to send a flare up, and I think your point is really important. Let's be very intentional about it, but anticipating is one of the things that we're supposed to do, because we're supposed to be closer to this. I think we're flagging that this is an issue right now. It's not only work a communication. Let's be ready in case it does kind of blow up. Jen, I know.
Well, the reason I'm saying for this meeting, right, Jen and I talk about messaging all the time.
Yeah,
I talked to the superintendent about messaging, right? Dr. Pierce is
it's not a position thing.
medical advisor to the school, Dr. Reed we talked to. And what honestly, I think people have learned to live with COVID. My experience over the holidays, a lot of people were sick, but nobody definitely sick. Nobody actually going to the hospital in Canaan. So that's a good thing. I think our vaccination rates and our booster rates account for that. But so I think, people who wear masks, they have particular reasons to. You go to church and, maybe 2% of the people have masks on now. Russ is doing extraordinary things at Waverly Care Center because the seniors are vulnerable. And I think messaging is a decision we have to make as to what level people have become very educated about this disease. Yeah, so I message, we're not in the phase of educating anymore. People understand the risks. I had a stroke in April because of COVID, I believe. My insurance believes that. Long COVID is an issue. Those are good, but as far as messaging further, you really gotta have people become educated. So.
Well, and the state health department does a lot of our messaging, and that's where it comes from. We don't just throw out panic for no reason. Right now, our case is nothing like last year. We had over 300 cases a week at this time last year. So to me, this is like nothing. You have to put things in perspective. To get everybody in a panic is nothing. You talk about emergency preparedness. We meet 3 times a month, all the health directors in Region 1. We have CDC deliverables we do. I constantly am updating the emergency preparedness plan. I work with Russ Kynes on everything. And that's, again, not a commission function. That's the state health department and CDC function. So we have our deliverables with the grant and things that we have to do, tabletop exercises, etc., that we follow. So, certain things are not up for changing because I have to follow what the state has us follow.
I'm not suggesting that we send out an alert, panic or anything like that. I'm just suggesting to the commission, it's called immune imprinting. New England Journal of Medicine is covering it. Cell Digest is covering it right now. The Wall Street Journal covered it 2 days ago. Talking about how COVID has pivoted. I just think it'd be well served if we just educated ourselves about it, then make a decision on if we do anything about it, or if we just educate our constituents, or we don't, or we just keep those facts to ourselves. But I do believe COVID has pivoted dramatically with XBB, and I'm seeing it. The healthcare system is seeing, the hospitals are seeing it. We're not hearing about it, but so anyway, that's my 2 cents.
So thank you for your suggestions. I think we do have to move on. Jen, as you stated, I mean, this is the preparedness, it's your function. It's not a commission function.
Thank you.
And that's, we can educate ourselves, be aware of what we have in the community at a given point in time. And, okay, so we
It's good for a change. No,
that's where we're on.
Change. Well, you're talking about, we haven't seen that change yet. Well, we do.
That's the point is,
Yeah, I
is
think,
being, have our antennae way to be ahead of it, so we can be wise.
So every week we get new information just on the local.
But everything changes. Look at China right now. I mean, that's COVID. I mean, we're in year 4 of the pandemic now. If everyone could predict it, it would be over by now. You know, but you have to also know the demographic. A lot of the public in the schools and the parents don't want to keep it being shoved down their throats. They're ready to, they get the information, they understand it, but then they move along with their educated decisions, whether they want to test before going to a function, whether they want to wear a mask or not. You know, at this point, you can't force somebody to be vaccinated. Whoever's been vaccinated is vaccinated. Let's be real. I've been trying to get my mother to be vaccinated. She won't. So.
Thank you, Jen. Thank you. Next item, Human Services, Bethany.
All right, so you received the report, just to go over some of the highlights. The food pantry has doubled in terms of usage, and the stats are on the next page. You can see, you can go over those if you have any questions. November, December eviction costs are over $2,300. That is unusual, and as a result of the economic arena, climate, things like that.
Eviction, how many evictions did you have?
2 evictions, and they run between $1,000 and $1,500.
It's 2,300?
2,300 is what we have not been billed. We're expecting another bill for probably 300. So what happens is.
There's just a K after the 2,300, so it looks like 2.3.
Yeah. Anyway, the 2,300. I have upped the budget for public health services. That's where probate, if we have to try to conserve somebody, evictions, everything goes. And there's a lot of reasons, some people want this eviction to happen because then the town is forced to move them out, put everything in storage. All they have to do is get a U-Haul, take it out of storage, which we have to pay for, and then they go on their merry way. So we've just saved them $1,000, $1,500, and it's a usable item that they have found out. So this is what we're dealing with, and there's nothing we can do about it. It is
And this
state
is a
mandated.
particular personality, right?
It's a personality.
It's loophole, it's not,
Yeah. Yeah.
it's not an overall eviction issue.
So most of the people have been, the process has been going on for 2 to 3 years. So,
Are these older people or ex-Wall Street?
No,
people?
no, these are
Council
people.
people?
Yeah. In terms of the, looking at them, they're middle-aged, usually no children. Usually no children, been out of work, learned the system as the years went by, and were able to take advantage of some good state programs, town charters and things like that. So there's nothing we can do. when they get to this point, when the state marshal calls me and we have to go out for an eviction. Anyway, it's not a pretty moment, but it has to happen under state guidelines. All right, and this month, Chamber of Commerce has moved in, as well as a new community impact officer, Anna Maria Cece, Nicole Rotuli, which served for a year as a community impact officer. This was the first time we brought somebody in to see what it was like, and I think definitely a success having the CIO on site in town, and they've been very.
What is their role? The CIO?
No, it's very broad, but they do work with the Chamber of Commerce and the town. The business district. What we have been able to use them for is going to evictions with us. Sometimes, you know, anxiety and stress is high with the eviction process. And we have had people come in, very agitated, anxiety ridden. Definitely our adult protective services has increased. And so it's Marcy goes out. If we need, there's access to the community impact officer. We have people at town hall calling now, you know, is the CIO there? Can you send them over? But it is definitely a personality and somebody at Human Services on a regular basis. And it's
important to realize that the police function, we just happened to realize we had an empty office, and so she found it convenient to stay there. This is not a human services function.
correct.
But they work with the downtown merchants to protect the downtown community. And so it's just.
It's become, yeah, what's happened is between Human Services, EMS, police, fire, it's become more of a community in terms of working and collaborating and helping the resident for many needs.
And then second, the Chamber of Commerce did not really move in, but we subdivided the building so that since there's a rear entrance, there's a separation between the
Yeah.
chamber.
Confidentiality remains
Confidentiality.
intact. Yeah, and so,
And that may be temporary. We obviously displaced them with their space at the playhouse, and
it's worked out
it
beautifully.
probably won't be permanent, but at least for the next year. Chamber will do
So
that.
we call it flex space, so that Chamber of Commerce is in there now. Other things, preparing the budget presentation PowerPoint, and I will show it to everybody when it's finalized, and you can see what I'll be presenting to the council and boards. You see the PSA campaign, public service announcements. It was very nice getting the New Canaanite report on the number of hits, things like that. This was just wrapped up. I wanted the contributors for the holiday outreach program were phenomenal, and once again, creating more cohesiveness and outreach to the community. Behavioral health, Buchanan Human Services, we're co-sponsoring in February, the town with Silver Hill. The town players of New Canaan are producing a February production of Ordinary People. And that has to do with behavioral health. So they've agreed, or they've offered Silver Hill in the town, for the town players, they're going to have a fundraising event, and proceeds go to the New Canaan Urgent Assessment Program. So we're very pleased working with them. Next Tuesday, I have a podcast with Andrew Gerber.
Yeah, tickets.
I'm just wondering, Joe, did you want to comment on the urgent assessment?
Well, sure.
Once we go.
Yeah, I have a 9:30.
No, you want to speak on that now?
Let's talk.
Go ahead.
You sure?
Yeah.
Okay, and then Silver Hill Hospital, I gave you the update. I got it yesterday afternoon. And there's the update with what's going on. It looks like October, we had 5 cases, November, total cases that came in and received help. Looks like we're getting 1 a week, which means there's room for more people being assessed. And as a result, Silver Hill has branched out with their, and this is how they planned it. They branched out with their multimedia program outreach, bringing more people in.
Do you think that's gonna pick up, or is it, did we?
That has to pick up. There's got to aggressively marketing and all sorts of things.
And they know, yeah, that's.
Yeah, I jumped in on the meeting with Bethany and marketing people from Silver Hill. They've got to get out and do more than have to contact each individual primary care provider. They've got to contact the schools. et cetera. One patient per week is not going to survive.
Where do they need roughly?
At least, I would run.
So there's a long way to go.
Yeah,
The schools are gonna fall.
Well, yes, and no.
Needed.
You know, I think the value of this program, and I just have a few
Yeah.
minutes to say fun about it. Value of this program, we're getting a profile of the team, right? And you know, and then we spent it big. I started this program basically, if we help 10 people a year, it's worth it. Because if we may have prevented 2 suicides in the point, 2 17-year-olds. And this program is, and the schools, the superintendent, they're thrilled with this program. New Canaan is very lucky to have Silver Hill. We're trying to get Darien or Wilton to join us. You know, we gave an ARPA grant for the first year. We're trying to figure out how we're gonna pay for the second year. The Canaan taxpayers will be in for something, and the school superintendent will be in for something, but ideally to make the program work, we would have another partner town or 2 or 3. So, but the point is, we really believe the program works, especially for the schools. And so again, I'm on the other, you know, other people think, you know, there could be 3 dozen or 4 dozen or 5 dozen people that ought to, you know, it's really, I'm surprised that holiday season didn't show us more. That may be a post-holiday season, they're gonna see.
Exactly, that's what they don't know, this is a pilot program, this is the first year, so this is definitely an exercise in
Right.
what's needed. What they need to do, and they hired, you can see, they hired a PR firm to alert the media of the program, they're ready to put it out there now.
You even see it on New Canaan Moms, where someone says, what can I do? And then people are chiming in, I didn't know this existed, I'm so glad to know
Yeah.
this existed, so it's.
I have a woman from New Jersey calling me today at 11 who heard about the program and doesn't want to talk to Silver Hill yet, but knows through it. She has a 16-year-old, she's very afraid for him. And this is what's happening. So once you, like the town profile,
And
I don't-
yesterday we had a conversation about whether Newtown might, you know, the reality is makes a lot of sense. Silver Hill's in the backyard with Darien,
Yeah.
Wilton, Ridgefield. We talked about the Westport, even Greenwich. But the point is, we're very lucky to have Silver Hill and a partnership that you never had before. So
And the Community Foundation is looking seriously at philanthropic contributions.
well, that's
The-
excellent point, Peter. We anticipated that the second year would be partly funded by raising private philanthropy, and that can happen if we vote. And we're actively working on that with so.
Well, but it's also to prevent emergency room admissions, because you want to catch it early in the system. So as long as we're tracking that, I think we get a good sense of whether or not it's being effective, whether it's being marketed up. So the need and demand is there, sure.
Yeah, it's the ultimate to emergency, because the care is better, it's for all sorts of reasons, it's working out families feel more comfortable and more willing to engage, it's private, it's a whole different deal. They have, yes, preventing 2 suicides, only seen making a significant difference in 10 people per year, it's great, but it's not going to fly. You need the numbers on all sides. It's not only patients going in, but it's the personnel there. They can't have the social worker, psychiatrist, the PA assigned to this and be available on a 24/5.5 day basis. It's, you know, you've got to be tactical.
Well, there's a mix,
Otherwise,
that's
it's
a
not
very
right.
expensive service.
No, I know that, that's what it comes to.
They like house.
Exactly.
Part of the business world, business people know how this.
Look at Darien.
They become more active, so it frees up some of the caregivers, so to speak, the providers in town or in the adjacent town, because they will be less busy. And when they're less busy, then they're going to make themselves more accountable, so it's like,
and we have to remember.
that's how it works.
The foundation, the Community Foundation did extensive research seeing where the disparities were in our town. And this is where it is, and this is, we're providing. And I think that is phenomenal.
It's a huge innovation, and I think there's support, but does need some refinements.
And
And
exactly,
there are learnings, and what I see people are really open to refining it and then
Yeah.
coming to the town with. Here's what we propose with these refinements. I think it's a huge winner. I know Lauren's really excited about it. And so
yeah.
it's a great policy, really.
I'm going to excuse myself, but I want to thank you all for your service. This is an important commission, and I really applaud you for your all your contributions.
Thank you. Thank you. Thanks for what you do and having our meetings. And last bit on that, so Dr. Gerber's book, the New Canaan Men's Club. Very, I'm not very impressed about me putting that on a podcast and sending it around to state area, whatever.
And we spoke at the Board of Ed, Dr. Gerber and I, and doing this podcast, so it's the Silver Hill, New Canaan, getting in there, and I don't want to say selling this program, it's just a vital program, educating people on the program.
Spreading the word.
Spreading the word.
Well, and it's also taking the stigma away from it. I think it's, which needs to be more focused on taking the stigma away from the willingness to ask for help, to see, again, if we're starting to see admissions, CV admissions going up dramatically for suicide coming out of this region, then we need to do more in order to
Yeah, so I think you look at Gen stats, the suicide, the DPH stats on suicide, ideation, things like that. What we're providing, the thing is that the emergency room, as we know, they have a protocol and it's ineffective most of the time when somebody needs to be assessed and have immediate care, not just discharged and sent home with the parent.
The fundamental structural issue that I know,
Yeah.
when I'm doing stuff at the foundation with Lauren is kind of what you guys have been saying is $1,200 per person. And for the acute things, of course, but there are cases that are not as acute. And in the month, the numbers just won't work. And that's one of the things we're trying to do is there a lower level assessment with just a serious social worker. We all know a great social worker will see issues. The Silver Hill is only like a Cadillac solution, and that's the refinement that we're all kind of working on. To have another tier, maybe initial assessment where it's not going through the full 4-hour. Psychiatrist.
Well, and maybe with the schools, working with like the sports coaches and stuff, because as we saw with Darien and at the collegiate level, sports, there's a lot of great benefits of sports. I played sports my whole life, but also the pressure, and maybe that could be a coach the kid will be more likely to listen to, go to referral on the quiet.
I mean, they have a great mental behavioral health program. They've added another part of it, Active Minds. They're on top of it. We're on top of it. Silver Hills in our backyard. It's like, we just got to group it all together and make it available. From a lot of different angles. No closed store, no, what?
I didn't have kids, well, I mentioned, which is the kind of person we're talking about.
Yes.
Matter for eligibility. For someone, is it someone who has no practitioners in place, or is it, sometimes?
At first, yes, at first it was just if you have not been in the mental health arena, we could bring coming in. Now they have extended it, realizing that some people do need to have that further assessment. They're calling their psychiatrist or their child psychiatrist that they had 2 years ago. No, starting over. Something didn't work. Let's see what else we can do. So that has come into the program now as well.
Yeah, they're original. They were concerned about being overwhelmed. That's not the issue. So they will take 10.
Yes, Peter said they're tweaking, they're working with the pilot program.
Starting out with Russian people call, right? The first few months were.
So there were
It was
36.
the other one for
There were about 36, so there were about 12 each month, July, August, and September, a total of 36. October, it looks like, they had a lot more phone calls, but the ones that turned into cases, like they had 43 phone calls, July, August, September, 36 of those went into cases. October, 10 calls, 5 went into cases. November, 15 calls, 3 went into case management. December, now this is what's interesting, 5 calls, 5 went into case management. So what you're seeing is people are understanding the program. They're hearing more about it, they're becoming more educated, and the percentage of calls turning into cases is increasing. It's all a process.
We haven't even seen a full year cycle.
We have.
We're only 6 months into it.
And you know, programs that have been around for years, you can look very clearly and say, this is when families
Yeah.
have the time to actually address something that
Yeah.
they've been living with.
So we're learning, Silver Hill's learning, but we are providing. And I thought that, December 5 and 5, okay.
Yeah.
And in general, you see in this country, there's a real mental health crisis. So as it becomes, I hate to say more normal to talk about, like,
Yeah.
no, I'm very open. I go to a therapist every week after everything I've gone through. And I hope that people like begin to remove this stigmatization about it
Part of the goal.
and begin to go seek that help, that there is help out there. You're not alone. And it is important for people of any age to know that.
This is one of the most important things we can do. I think it's important.
And that,
Successful, but we have to move on.
okay, so I just want to say. Okay, so,
Everything else looks pretty much in print.
yeah, I just want to show how everything's doubling. The 6 months of this fiscal year, we have reached what we usually reached by the end of a fiscal year. We've spent already $24,000 helping people. $24,000 was our complete year last year. So we're 6 months in. Our largest human service arena right now is behavioral health and energy assistance and housing. Energy assistance, we usually don't top off an oil tank or fill an oil tank until the energy assistance programs and the safety net programs, they run dry, and then we come in. We've already come in now, December. We're filling up tanks because the people have run out of money.
Am I reading this wrong? On the one page, it just says energy assistance, 2 applications per month. You think it's one?
Well, you see, they started out, what happens is they really sign up in October, November. We've gotten 38. In 1 month. Now, these are people thinking they didn't need energy assistance and they're calling because they run out of money. Where you, Russ, let me see.
I was just under Marcy Rand's report. that she
Right,
had.
so she,
Look at 2 new adult protective services cases,
yeah,
2 referrals to EMS, 2 applications per month under energy assistance. I'm just trying to get a.
the energy, so we have a total of, what did I give you, a total of energy, if you look on the yeah, I didn't put it on this one. I got so we've had 44 energy assistance applications. You can go directly to media agency, action agency, and get it. But some people want to do it privately. We have 44. Last year we had 38, but the awards are less. The gas costs more, the fuel costs more, and it's bringing.
Well, it's gonna be interesting if January starts the new electric rates.
Yes, and Katy Parish has never had to
Yeah.
pay their own electric heating bills before. They just moved into their new, now they never were responsible for their own
Bandy's the problem.
heating, and they're coming in,
It's a
and
huge
so,
surprise.
Yeah.
yeah, they're totally surprised. You can see what we've spent.
A major topic yet on the agenda?
Yeah, we're quite time is.
Because I think.
About this, anybody, if you have any questions, let me know, but housing, energy assistance, and behavioral health.
Thank you for the presentation.
That's all I had.
My on-bill business grant request, so Russ Mine has been well taken. That we, dealing with these grants, we always do it in December, and a day or 2 or a week later at the most, Bethany has to present these numbers. I think, and the letter goes out to invite people to participate or be recipients of the grant in September, and then they're supposed to respond in November. So by the time, late November, by the time that rolls around, it's all the information is in front of us in December 1. She's got to present this. We don't have time to really evaluate this. And granted, Bethany has the working relationship with these people. She knows what they do, what they don't do. So she'll be the ultimate source, and probably all the time we'll just go along with what she says. But I think we've got to accelerate that in our schedule. So maybe in October, November latest, we can bring the information unless you can't do it.
It's just, well, that's the thing, it's hard with the programs. in terms of having them write these.
Yeah, well, that's, I mean.
And so that's what I have to,
Money that-
but I work with them
Yeah,
because,
let's see if we can move that up, at least a month, so we.
Yeah.
The solution has always been that we bring the key people in, kids in crisis, for instance, should be making an annual visit here, as well as the domestic violence people, et cetera, et cetera. So that's how we solve the top 3 or 4 grant requests. A lot of them are here before the group every week, every year.
There's also a way to, have our perspective and be a little more directive, like, hey, we think these are the big things, and you can go to your folks and say, hey, we're game on for what you are doing right now. You see what I mean? So we're not as passive. We're able to signal to the organizations that you think are most relevant ahead of time. You see what I mean? That way we can influence it a little bit more.
Yeah.
And Harrison's point about being early is I think the key.
Okay, next item, role of the commission priorities. So this is the big topic, so, a couple of things quickly. This is, Health and Human Services. Commission is the combination of the Commission for the Aging, Youth Commission, Board of Human Services. That was before the amalgamation along with HHS. The commission develops and coordinates information concerning all age groups, analyzes the services and programs provided by federal and state agencies, and assists in finding them to maintain residents. They generate community focus to evaluate create quality programs that best meet the changing needs of the population and establish policies and procedures to assist the residents in needs of critical assistance such as food, shelter, safety, and the health services, including mental and physical. The commission also makes recommendations to the selectmen, and that's what Kevin was pointing out regarding the development of new programs for unmet needs. So the mission statement per se is the basic mission of Health and Human Services is to evaluate and coordinate critical community needs and programs for health, food, shelter, and safety. Toward that mission, the commission provides oversight of the Health and Human Services Department. So that is one of our prime functions. They talk about the commission being divided into 4 subcommittees. Well, we did that X number of months ago. So there's the health and then the human services of 2 major departments aligned. Then we had these subcommittees, which was youth. So it was Alicia doing that in combination with Jackie. And they did this before and they continue to do it after. They function very well. And no negatives about the senior grouping, which was Jim, and Marcy and Russ. But they really didn't communicate. Maybe they felt there was no need to, or whatever. The health thing, which was Jen, Bethany, and I, we have our PRN communications. So it's really, and that was disappeared that the subcommissions on when COVID hit. Anyway, so that was just historical comment. So Bethany wrote a letter when she was considering not having Marcy and Jackie appear at our meetings. She went out to a number of people, health departments in other towns. So I was going to read a couple of the responses. We look at things differently, and those people are looking at us as an HHS. So I'll read a couple of these things. I present to the department. Sometimes I include a social worker to talk about the program we do. The commission is supposed to be advisory on policy for the department, both the senior center and social services. They try very hard to influence operations, budget, program, and staffing, but that's not the role of the commission. Good people, but searching for a purpose. Next responder was, I present to the Commission on Aging. It's supposed to be for them to help me out when needed or give me suggestions. However, sometimes it feels that they want to guide things, which has caused some controversy during our Zoom meetings. Lastly, I've run out of ideas for the Human Services Commission. I'm down to 3 out of 7 members due to lack of purpose. I cancel HSC meetings regularly. I struggle to develop actionable content and spend more time planning than I should. My experience is that we have a lot of well-meaning people who like to be on the commission, but do little to support the mission when asked, or we have very eager beavers who are engaged but tend to micromanage. The bottom line is they need to be reminded of their advisory role. So
Comments or votes?
Those are directors of HH.
So the directors. The directors, human services directors in the area from Greenwich to Stratford. We have a Zoom meeting, we meet, and so I wrote out an email saying, how do you utilize, what is the role of the commission? And so this is some of the feedback I got. That's all. But this is from the directors of human services in other areas, Wilton, Darien, Westport. I put in the comments that demographically were similar.
So was there anybody that was really thrilled about their,
Well, for the health department, my counterparts only meet quarterly because again, we're dictated by statute and the commissioner of health. So it's great to have, talk and everything else, but we have so many mandated things we do that essentially they only meet quarterly to just say, here are the numbers, whatever, because they cannot take on more work. We don't have the staff. We have enough by statute to inspect and to do. And I think that's kind of the consensus all around. Where district health department, their board of health is their governing agency because they don't work for a municipality where the budget goes through all these other boards and commissions. So it's different by statute.
And then human services, it's the case management that is critical, and each case, it can be hours, days, or that doesn't work, we go on to the next possibility, or there's a change in status with the family, the individual, domestic violence all of a sudden comes in. So the case managements are very individual, very confidential, and I do feel that the commission is being asked to make decisions. It's not fair to ask the commission, well, what do we do? I mean, how do you all possibly know? How can we give you all this information for you to make a broad decision? It really, I think it puts you at a disadvantage. Happy to answer questions at the same time. The role is not, it's educating, as the mission statement reads for human services. It's educating as well as trying to provide resources for those in need, whatever need that is in the community. How do you better that? I don't know.
I think one thing that I think a number of us have sort of like we're circling is we don't want either of you to be doing any more work than you are already doing. And I think one way that we can alleviate that is if we find a way to educate ourselves without you having to come and explain every single thing to us necessarily. So how can we better educate each other so that it is a little bit less work?
Well, how do you
There's a natural dynamic, between senior management, which you guys are, and a board of directors, right? There's a dynamic where the board of directors has oversight on things they're doing, but the people that are running your program, the people that are running operations are always going to know more than the board of directors that are there. So that dynamic is always going to exist, even though we have for our charter an oversight. What I think everyone is trying to say here is that if we're able to, instead of adding work to you, say, here are 3 things that are extremely important. We want to put the entire power of the entire town behind these 3 items or 4 items. We want to go get grant funding for things. Think about what we just talked about when it came to Silver Hill, right? And how that developed. Those are the types of things I think we all became commissioners for. We didn't come commissioners to micromanage what your budget is or what your functions are. But we have a charter. Our charter is oversight. Our charter is developing priorities and making recommendations. That's our charter. We didn't define our charter. And I think if we stick to our charter, but help refine, I think hopefully that makes your life easier. Hopefully that brings more dollars into very specific areas for you.
I have to interrupt. I have to disagree because the health department, I have statutory requirements on how many times a restaurant's inspected. How many times the salons are inspected, the public pool, the immunizations, the daycares are inspected, the septic, the building permit. That's not up for debate. That's not up for anyone to pick my priorities. My priorities are picked by the state and the statute. So for human services, if you want to pick, mental health or whatever, I understand that. But with my stuff, we can't just decide, oh, forget it, we're not gonna do restaurants, and that's not a priority.
I don't think anybody said that. I think what we're saying, well, at least what I'm saying. You have a standard line of business that you do every single day. There's nothing that we're going to do or make a decision that's going to influence the standard book of business that you have and what you have by statute. But there are ways to identify issues. I come back to Silver Hill, where we can help get behind and we can help fundraise and we can help bring a sense of priority to the town. That's all I'm talking about. I'm not talking about getting into the weeds of, we're setting a priority that we're not going to inspect restaurants. Absolutely not. You have standards that you have to follow, and but there are other things that are not being addressed. And that we would like to address. That's the difference that I think.
I think it's helpful to make a distinction between that, like each day and the wider thing. So, and my background's more in human services, so that makes perfect sense to me. Like we can't know about the different cases that you're working with. But if we're talking about larger things like why domestic violence issues have doubled in the last 2 months, then that is something we can do, not saying who it doubled with, but what can we do to take off of your plate, where it's you have to meet with people, you have all of these things that you need to do. You don't have time to be doing a podcast with the New Canaanite all the time, or making sure the town knows this is something that's happening. Like it's sort of identifying what can we do that's appropriate to what our experience is and what our role is, that takes something off of your plate. Because we can't say, well, let us take 3 of those cases for you because you're too busy. Or let us inspect 3 restaurants for you because you're too busy. We can't do that. But we can identify what is the advisory. I think advisory is the confusing thing. How do I act in an advisory role for you? I'm not going to tell you how to do your job. So it's sort of identifying what can we do that takes something off of it.
It's very important that you guys are not the sole focus of what we're doing. We're not just advisory staring at you and trying to help. There's the broader town that needs perspective on budgets and stuff like that. And all the ecosystem is really big here. I mean, the community foundation and all of that. And if our whole charter was just to be all over you guys, that's a disaster.
But again,
And
the
it doesn't work because it's not like we're going over because you refer to us. So, but I want to keep the conversation away from we can be more in your.
to understand, like something like the budget, here's the board of selectmen, here's board of finance, there's town council. Town council is elected, they can't add to the budget, they can take away. So I know everybody wants to get involved in everything, but everybody has a role. There are boards to do all this stuff.
And I think less budget and more like who can we bring each month? You give abbreviated reports so that we're learning alongside you, and the burden isn't just on you to be teaching us everything that you know.
Also, I sent an email, I sent a couple emails now, saying, would you like to have this as a as a speaker? No one responded to me.
I got.
Like-
We're not finished.
Okay, so
So again, health department is more strictly defined than human services. I mean, that's the way it is. Let's move on. And for the sake of time, so brief summary of last month's meeting. Behavioral mental health was clearly number 1 in everyone's opinion, one way or another. The youth probably more so than the adult, summarizing the priority. With the kids more than the adults and seniors, even though that's a factor. Financial issues was prominent, mentioned almost universally along different lines, which is what the APS component does. We did get communication from our background and with input from Peter Campbell, which I will briefly summarize. Talk about the Health and Human Services Commission developing a collective set of priorities to help guide the commission's oversight. She, and he mentioned behavioral health and mental health, depression, anxiety, suicidal ideation, domestic violence being 1, 2, substance misuse, intervention, prevention. Also the self-medication is mentioned, which is a component, another one of that, which some people, be the kids, adults, whatever, are self-medicate themselves with the use of a safety net for those needing financial, medical, whatever other hardship. Shelter be another one. And then lastly, emergency preparedness, which is, it's an issue with multiple components. So you've got Russ Kimes, who is the director of emergency management. So that's sheltering, things like that, so part of his daily work. You have EMS, PD, fire department, that's all part of the composite. I don't know exactly what our role other than being a component.
We meet monthly, the team, the EOC team. And again, the health department has their own deliverables for emergency management through the state and CDC. And in the town meets monthly just to work on our own local emergency operations plan. And that we continually update, and we do tabletop exercises and drills.
And Health and Human Services has a big role.
Bethany's involved with the shelter, and Kevin's involved, PD, police, fire, everybody on that, public works.
So those are priorities that Barb and Peter put forward. Jim, I spoke to yesterday. He has a couple of ideas. Kevin alluded to one with the mental health and combining something with telehealth and Newtown. And also Kevin mentioned the senior housing, which he's asked Jim to be someone involved. So those are other priority items we can deal with. I think when you look at what we do, and the staff consists of 3+ people. And when you look at the reports and both the verbal or written, whatever, they are very busy. And they're doing a lot. And when you look at everything they do, there aren't many gaps of what they're not doing or what we're not supporting them doing. It's so, we do flounder around for, what can we do that's more? And I think, as I mentioned, frustration, and you mentioned that what are my plans for next year? I'm one of 9 commissioners. I do happen to do the agenda, but I don't control the topics. Okay, so everyone's free to speak. We all want to do more to help, but there is a limit somewhat to what we can do. Tom knows the relationship between the nonprofit versus the government defined entity. So there's a little conflict there. You want to talk about that? So we want to be functioning commission. We want to do what we can do to help the town. We want to help the staff, and we just have to know what in reality we can do to affect this. We're not psychiatrists, we're not psychologists, we're not clinical social workers, we're not a charitable fund where we can just decide how to dole out the money. We do a little granting, yes, but so we've got to, we know what we want to do, what our goal is, but we have to know our limits too.
Personally, just to refine that, the ability to within that, what you just said is influence. And that's one of the big things we can do, is channeling what we're hearing here from you guys. And I'm doing a lot with the foundation right now. And everybody's got their tentacles in, and I think we can influence the whole ecosystem. And that's kind of my point of not being all over these guys all the time, it's learning from them and from where we sit. Creating a common perspective on what the issues are so that all the groups out there, and there are dozens and dozens and dozens, are kind of singing off a relatively similar signal sheet about what the real big issues are. And if we do that with the foundation, it's chiming in where they are, and Waveney and the hospitals and all these other groups, that is not getting in anyone's grill, and it's not making more work, but it's trying to align a perspective on what the big issues are. And he's got too busy to be doing the communications all the time, but aligning that is what we can really do in shaping town council where they need some perspectives and.
Question, is it productive? Should, and it's just a brainstorm.
Right.
And I haven't thought this through, it's just coming out. If Jen and I came in, gave our reports, and then left. Is that something then you can discuss and things like that, or do you want us here?
Look, again, we have the interest of time, I think we saw that today, all, but right. I, without the data that you provided, we would not know. I would not know that suicide ideation was a big of an issue in town. In our town of New Canaan,
It's a
as this,
report.
without having your report and your data. Look, please,
The narrative.
please let me just mention, I mean, another is domestic violence. We wouldn't know the severity of domestic violence without having the data and getting the data from you. So I think what everyone's trying to say that once you provide the data, we're not trying to influence what you do, but then it allows us to bring some influence or run the flag up the pole and say, we need to get a lot more people involved, other nonprofits involved, donations involved, whatever to help address this issue. So it's not all falling on you, so that we can affect in a positive manner domestic violence, so that we're not fielding so many calls per week and address. I just use that as an example because that's the importance of the data that does the project.
Yeah,
Right, so we're gonna
if you
move on.
wanted to do more roundtable talking and.
Next member terms, we've done, New Year's resolutions, all right, here they are. We have a speaker every 2 to 4 months, say 3 months, and yes, we talked about Warren Patterson being one, Kids in Crisis being two. I like the hands-on kind of thing, which, so like I started when I first started the food pantry, going to that, and then COVID hit, and then that disappeared and what have you. But, we commissioners could alternate and have one of us present anyway for the food pantry. Gives us a sense of what we're getting. But another thing is, I like the holiday visits where we drop little gifts off and interact with these seniors. So when Jim and I did it, we had one person's not available, which Jim wouldn't be. The other one didn't answer, and I was there last year. 45 minutes to come to, and when I did, it want to leave or whatever. He was out, broke his shoulder. So somebody's been doing this, so maybe I know staying put visits for those members of this, and I don't know whether all these people members of staying put, probably not. But we could do that also as more of a hands-on thing. I love doing the vaccines.
I was just gonna say, you're welcome to.
I was doing something like that, sitting around that. That's something, and I need your input for that. If you want to do that, if you want to rotate with food pantry, if you want to do visits. Okay, so let's do the minutes and then we'll move on. Let's see what the staff president meetings. I know Jen's people are too busy. I miss having Marcy and Jackie here, and whether we could go back on that on every.
The problem with Jackie was she started to get too involved with the details and people were asking questions, and I think it's better written than.
We can deal with
And I think
that.
she has
I like that.
meetings and things too, that this is actually fun.
But what Peter and Russ just said, I do think, and I've talked to Alicia and Kim Norton about this, of getting all the nonprofits together and, who does what the priorities are. I do think that is a good idea because there is a lot of duplication going on. Nobody knows who's doing what. And I do think that should be something we do work on.
I do
Nobody
think
else
that,
is doing it really.
Right.
It is a gap in the ecosystem that we can, I think, fill.
Yeah, I agree.
effectively in channeling what you guys are doing, which is.
Here's the final headline. Penny and I have probably been around longer than most of us in this room in terms of.
Hey.
We looked at it was a problem. But I gotta tell you, this is one of the most admired towns in the state for what our health and human service people do. We've been one of the most creative and innovative towns on a going basis. Waveney, Staying Put, telehealth, et cetera, the line goes on and on. And one of the things that I always walk away from here is the interconnect between health and human services. Many times it's kind of fuzzy in between, but we are doing things that no other town is doing. It's well known. Again, I've talked to probably 40 different towns over the last few years, and I'm now working at the state level, looking at these things. I can tell you this town is admired.
And I think to that point, we see
Oh, chaos.
they are, and we want to meet them where they're at. And we're also very clearly a group of type A personalities who want to process all the data and then organize it in our brains and then figure out how to make sure that we continue to be the #1 town for these things.
So when I give you the emails of information that's going on or the brochures, those nonprofits that are doing this and that, do you like that? I mean, I don't get that.
Yeah.
Okay. Yeah, I mean, to me, I thought,
But maybe we can organize, you know, in the near future, some kind of meeting for everybody together and let's discuss the different things, even like the ARPA, not only Silver Hills, but Waveney's with the telemedicine. That, you know, there's a lot of things going on that are great that I don't think everybody knows about and we can help touch every part, because obviously we can't on the government side do everything. We need the help of
yeah, I mean,
nonprofits.
that's.
We need Waveney, we need these other organizations.
And we need to be able to speak to them on a dime. If anyone says, oh, I don't really, if that's in the position of power, like, oh, I don't know about kids in crisis, we need to be as educated as possible. to
It's
refute
possible,
that.
exactly, or if you, I not call human services, this is where, you know, this is the
Right,
meat
right.
of our department. Is having resources, part of the mission statement, having those resources and those personal contacts. Every single brochure you see, plus we have 20, 30 more at Human Services. One of us, Jackie, Marcy, and myself, can call directly to someone there and get immediate help, question answered, a contact, a connection. So that, yeah, it's very important, and yeah, love it. I can just keep sending information as I get it.
Last time,
Okay.
minutes, thank you, Melissa, for doing this. Do we like the format of the minutes, the way they are, et cetera? When I saw we had 14 pages.
We're not
somehow-
gonna talk about minutes.
14 pages somehow. 4 from HS was like.
Penny's having PTSD.
We're only at 7 right now.
No, I think your minutes are great because then I don't need to sit here and verbally say every statistic. And it's put on the website, everybody can see it, nothing's hidden, and I think our residents like an open.
The feedback I've got from COVID safe families in town is they appreciate all that you do and your report, and I literally I'm copying and pasting it. I can definitely truncate it a little bit, but
No, I think it's great because they're seeing all the important things. It's not
I
confidential.
don't know if we as a public or the commission, maybe the commission do, but do we need the 14 pages? And I know that goes to the state as part of the job. But, you know, just wanted to rush you.
Yeah, look, every topic that we brought up could be its own meeting,
Yeah.
right?
Yeah.
So let's just start there, and then the fact that we trying to cram so many different things into one meeting is one thing. So to the point of the minutes, we have 2-hour board minutes, and we try to get it down to 2 pages. And just highlight I just think that
This is.
there is a way, I think, just to help you, because what you do is phenomenal. I wish I had one of you on my board to sit there to write everything up. Yeah, it's paid position. I think we can get it down to a 2-page of here's the issue, whatever, and then just put the attachments on it. With the attachment, I think just making it easier for you.
Different from a private, what we do is for the public, the people. So the more information we share in the town, the better. In a private company like Wade or anything else, generally the minutes say as little as you.
Yeah.
as you get away with. So it's a different set of rules when you're working with the
But
government.
her, instead of being almost a narrative of the meeting, that here's what was talked about, here's the decisions that were made, here are the attachments from Health and Human Services. I think it'd be an easier.
I agree, because there's no confidential data in my report, there's no names, there's no nothing. So if that helps, that would be perfectly fine.
It's very easy to
Is that
link it.
helpful, Harrison?
I don't know.
He's like,
Somewhere.
Usually on the share the line.
We discussed this before, where we did go from X number of pages down to about 4 or 5 or 6.
Yep.
And then I said back up to 2.
Well, she had like 5 more unfunded mandates of reports to include. Her report got her.
yeah, my report's not much more just one.
All goes to the state, you have to report that anyway, and it's a good thing for the public, as Tom says, yeah, I forget about the little public component there.
Yeah.
If you're looking at the TV, at the 18 pages or one that's devour that, I think when you see the numbers, a lot of the public would turn that and go the other way.
What do you think about the meetings being longer, going till 10:15? Does that give you more?
Or maybe start like picking a topic and,
Yeah, I think we, the role of the commission is the time consumer. I mean, sometimes it helps with the measure. And this has been kind of a healthier, with all those COVID, et cetera, that's been going on. So I think if we can define it a little better, maybe leave the most important thing to the jump in the middle and the review. Both ends of it. Okay.
Good.
Barb, anything? No. Oh, you. Okay.
So
Muted.
Muted, yeah.
First and second motion.
I was muted when I started talking. I don't know. That's just.
Okay.